The California healthcare system is in a state of crisis. The population is growing rapidly, and there simply are not enough primary healthcare providers to meet the demand. Inadequate number of primary care physicians, coupled with the uninsured and underinsured, are leaving millions of Californians without accessible primary health care. At the heart of the issue is patient access to affordable and effective primary care. The demand for affordable primary care is skyrocketing. There are over 3 million Californians without health insurance, and millions more are underinsured to the extent they cannot afford a physician's office copay. Tens of thousands are losing health coverage due to job loss. Unemployment is well above 12%, and California has experienced an 8.5% population growth over the last 8 years. Although demand is increasing, the physician providers for primary care services are dwindling. More and more physicians are choosing medical specialties such as surgical subspecialties and radiology instead of primary care due to better pay, better working conditions, and better lifestyle. Additionally, many primary care physicians are choosing not to accept Medicaid patients because of low reimbursement. Nurse practitioners provide an ideal solution to the present healthcare crisis. Nurse practitioners provide an effective means to increase consumers' access to affordable and high-quality healthcare services. Nurse practitioners are registered nurses who possess master's degree in advanced practice nursing. By 2015, the standard for all nurse practitioner education will become the doctorate degree. Nurse practitioners are trained and educated as clinical experts to perform comprehensive physical exams, order tests, diagnose and prescribe treatment plans for common and chronic and acute disease. Nurse practitioners not only prescribe medication to correct problems, but also focus on educating patients in disease prevention and healthy lifestyle choices. There are now over 100 research studies that support the fact that nurse practitioners provide safe and cost-effective care. With over 15,000 nurse practitioners in the state, nurse practitioners represent the fastest growing segment of primary care providers in California. Nurse practitioners offer a natural solution to California's primary health care problem. Unfortunately, there are barriers that prevent patients from directly accessing nurse practitioner services. Specifically, nurse practitioners in California do not have a statutory defined scope of practice as what they are allowed to do. Additionally, California law and regulation will not allow nurse practitioners to work without a supervisory relationship with a physician. Although 23 states allow nurse practitioners to practice independent of a physician, California is in the same category as Mississippi and barring patients' access directly to nurse practitioners in the absence of a physician supervisory relationship. California remains one of the last states where nurse practitioners do not have a statutory defined scope of practice. Additionally, California remains one of the last states to recognize nurse practitioners as independent providers of care. Nurse practitioners in California remain in the last category of master's and doctorate prepared providers, such as dentists, podiatrists, psychologists, optometrists, and others that are required to have physician supervision. The draconian rules requiring physician supervision for nurse practitioners are not based on logic, scientific evidence, or even common sense. These physician-centered rules are based on a time, long ago, when nursing was considered a profession owned by physicians, during a time when nurses were considered handmaidens, and during a time when nursing was considered a servant role to physicians. Over the last century, the world has changed, technology has changed, and healthcare delivery has changed. Yet laws pertaining to nurse practitioners regarding physician supervision mandates are still based on the parochial, physician-based medical paradigms of the last century. Legislation is needed to bring nurse practitioner practice into the present century, and the time for action is now. Although overwhelming research supports the safety and efficacy of nurse practitioner practice, Action is needed to eliminate artificial barriers that serve only to impede consumers' access to quality health care. Action in the form of legislation is needed to provide nurse practitioners with a statutory defined scope of practice independent of physician supervision. Enacting legislation defining the scope of practice for nurse practitioners and eliminating the need for physician supervision will have substantial positive benefits for all California consumers. These include eliminating artificial barriers preventing access to quality health care for all Californians, instantly provides 15,000 additional clinical experts in primary care to Californians, reduces costs for those primary care services, updates regulation properly reflecting what nurse practitioners can do and their education, reduces numbers of nurse practitioners leaving California to other states with independent practice, reducing wait times for primary care appointments, and it will give consumers a choice between physician and NP providers. Pursuing legislation to improve consumers' access to quality and affordable family-centered health care, however, will have strong opposition from forces with a financial interest in controlling nurse practitioner practice. These include physicians, medical associations, and powerful lobbying firms representing physicians' financial interest. Enacting legislation to provide for independent nurse practitioner practice would sever the financial stranglehold that physicians have had over California nurse practitioners for nearly 45 years. Consequently, medical associations continue to spend millions of dollars in their lobbying efforts and remain in lockstep in California and throughout the country in opposing any legislation freeing nurse practitioners to directly provide care for consumers. Strong support for independent nurse practitioner practice is expected from nurse practitioners, consumer advocacy groups, and the profession of nursing itself, which, survey after survey, defines as the most trusted profession in the United States.